Hi everyone, and welcome to the Academy of Online Radiology Education blog. My name is Aaminah Kobeisy, a postdoctoral research fellow at Massachusetts General Hospital, and today we'll be going over the role of AI in lung cancer screening. The first study we'll go over is titled Assistive AI in Lung Cancer Screening, a retrospective multinational study in the United States and Japan. This study was published in Radiology Artificial Intelligence, evaluated the impact of an AI assistive tool for lung cancer screening on clinical workflows in the US and Japan. A total of 627 low-dose chest CT scans were included, 330 in the US and 297 in Japan, in this retrospective randomized study. Each scan was read twice, once with AI assistance and once without, by 6 thoracic radiologists at each location, with a 1-month washout period between the 2 reading sessions. For each CT study, radiologists provided a level of suspicion score for malignancy from 0 to 100, a LungRad score or its Japanese equivalent, and management recommendations. In the U.S. reader study, AI assistance resulted in a statistically significant improvement in level of suspicion score AUC of 0.023, with improved sensitivity and specificity compared with unassisted reads. At the LungRad's 3 or higher threshold, which was considered as a positive lung cancer case, AI assistance increased specificity by 5.5%. In the Japan reader study, AI assistance resulted in a level of suspicion score AUC improvement of 0.023 as well, which was not statistically significant here, likely due to the smaller sample size. However, significant improvements in specificity were observed. AI assistance increased specificity by 6.7% for positive findings in Sendai score B or greater, and by 5.1% for Sendai categories C or greater. Similar to the U.S. reader study, sensitivity increased across all scores. The key finding in this study is that the AI assistive tool assessed in this study for lung cancer screening improved specificity of radiologists in both the U.S. and the Japan studies. The second study we'll go over is titled Potential for AI as First Reader in Lung Cancer Screening, published in the European Journal of Radiology, assessed the agreement between human and AI readings for low-dose CTs according to LungRad's categorization, and testing whether AI can safely be used as a first reader in lung cancer screening. A total of 4,104 low-dose CTs from the BioMild trial were included retrospectively in this study. 2 radiologists performed baseline evaluations of these low-dose CTs and categorized them into LungRad's 1 or 2, which was considered as negative for lung cancer, or LungRad's 3 or 4, which was considered as positive for lung cancer. Ground truth was defined as the histological diagnosis of lung cancer within 2 years of baseline imaging and was used as the standard to test the performance of radiologists in AI. Images were analyzed by the commercially available AI software AView by CoreLine for classification into LungRad's categories. The agreement rate between human and AI readings across all LungRad's categories was 54%, with a kappa value of 0.41. When considering the classification of low-dose CT into negative, or LungRad's 1 or 2, and positive, or LungRad's 3 and 4, the agreement increased to 83.5% with a kappa value of 0.44. The key finding from this study is that AI showed moderate agreement with human interpretation and similar sensitivity, but reduced specificity with a very high ability to rule out disease, supporting its potential role as a first reader triage tool in lung cancer screening. Overall, both studies suggest that AI can effectively support lung cancer screening by maintaining high sensitivity and excellent negative predictive value while improving workflow efficiency. However, AI performance is characterized by moderate agreement with human readers and reduced specificity, leading to more false positives. These findings indicate that AI is not yet suitable as a standalone diagnostic tool, but shows strong potential as a triage system to reduce radiologist workload and support clinical decision-making. Thank you for watching. For more updates on the latest in radiology research, be sure to follow the Academy of Online Radiology Education blog series. Thank you and see you next time.